A new procedure is letting more heart patients have clogged arteries open safely. Allegheny General and Presbyterian Hospital here in Pittsburgh are among 110 hospitals nationwide using the new technique that uses tiny balloons instead of surgery. Marilyn Brooks has details.
Here for me, just that's good.
When you get to be 76 years old, your plumbing or coronary arteries do tend to get a bit clogged. Joe Forrest was so bad he wouldn't have survived without some kind of medical help, and he felt it. Talking's tough, his throat sore from a breathing tube, but he knew he was in trouble, also knew he had a few options. Bypass surgery for one. It helps 350,000 patients nationwide every year. But for an ex-coal miner with bad lungs like Joe, it was much too risky.
After surgery, it would have been very hard to get him off the ventilator because of his underlying lung disease.
For another $200,000, balloon angioplasty is the answer. Doctors thread a tube or catheter into the artery, inflate a balloon, and squash the blockage into the artery walls. But this too has risks. It can shut off blood to the heart. So Joe Forrest became one of 7 patients here to be treated with something new called retroperfusion. It's very similar to the old technique, except that it uses 2 tiny balloons, one to unclog the blocked artery, the other to carry oxygen-rich blood from a leg artery to the heart. That ability was the important difference that made survival possible for Joe. There are only 3 arteries that feed the heart. These films of Joe's procedure show 2 are totally blocked. A third is 95% closed.
If he had complications in that third artery, his blood flow to the heart would be very severely undermined.
That didn't happen because the new procedure allowed doctors the time to safely unclog all 3 arteries. What do you feel like now? So new, in fact, he goes home tomorrow. Marilyn Brooks, WTAE 4 News.